Hello, and welcome to the training for Inclusion in the Exclusion Policy. This is brought to you by the Department of the Air Force 75th Force Support Squadron, AFMC, Hill Air Force Base, Utah. This policy provides detailed guidelines on exclusion and readmission of ill children. These guidelines must be adhered to in order to minimize exposure to contact with potentially infectious agents and to reduce the spread of communicable diseases. This program does not allow ill children to be in attendance unless cleared by a medical professional. Written statement must be indicated that an individual is not contagious or that that individual is in an appropriate therapy to attend childcare. Number 1. All children who attend Hill Air Force Base Child and Youth programs must have received all required immunizations. This includes the entire current Center for Disease Control and American Academy of Pediatric recommended vaccinations against contagious disease. Can you take off their collars? Thank you. Children will not be admitted to the Child Development Center or Family Child Care home without proof of the required immunizations on file or documentation authorizing the delay or contraindication of receipt of the required immunizations. The staff must conduct a preliminary health check on all children upon their arrival to the program. The staff members should look for any changes in a behavior or appearance from the day before, any skin rashes, an increase in body temperature, or complaints of pain or not feeling well. The director or representative is authorized to refuse admittance to any child who shows symptoms of a communicable disease. When we were talking about our 1930s training, that H on each of the numbers there indicates you have done a health check. Parents are not required to take their children to a healthcare provider when the child is released from the program due to a possible illness. Parents may bring their children back to the program once the conditions no longer exist and the child is symptom-free or the required treatment has been administered. Or the time span has lapsed whether or not the child has been seen by a healthcare provider. If a parent chooses to take their child to a healthcare provider, a note indicating diagnosis or non-contagious illness is needed for readmission. However, a note from a child care provider cannot override the guidance that is set forth in this specific policy. It is the responsibility of the parent to have alternate care available when a child needs to be removed from the program due to health concerns. For the exclusion of children, there are requirements that are based on the advisement of our pediatric medical advisor and our Caring for Our Children book, which is considered to be an Air Force policy for details. The program will ask for a parent to pick up their child from the program, or they will refuse admittance to the program if one or more of the following conditions exist. If there is an illness that prevents the child from participating comfortably in normally scheduled indoor and outdoor activities. If there is an illness that results in the greater need for care than staff members can provide without compromising the health, safety, and well-being of other children. If the child has any of the following conditions: lethargy, which is tiredness, irritability, persistent crying, difficulty breathing, a quickly spreading rash, or inability to participate in the normally scheduled activities. If they have a fever, accompanied by any behavioral changes, an unaccompanied or unexplained temperature of above 100 degrees, if the child is younger than 6 months, should be medically evaluated. Your temperatures for the CDC include, if you're over the age of 4 months, 100.4. That is what we call a fever. If they are below the age of 4 months, it is 99.5. Any infant younger than 3 months of age with any fever should get urgent medical attention. This also mitigates the risk of a febrile seizure. Diarrhea, more watery stools, the decreased form of stools, or an increased frequency not contained by the child's ability to use the toilet until the diarrhea resolves. Refer to Caring for Our Children when diarrhea is caused by Salmonella serotype typhi, E. coli, or Shingles infections. vomiting, persistent abdominal pain, or intermittent pain associated with the fever or signs and symptoms. Mouth sores with drooling unless the child's primary care provider or local health department authority state the child is not infectious. If they have a quickly spreading rash, until the primary care provider has determined the illness is not infectious. Impetigo, strep throat or other streptococcal infections. Admittance 24 hours after the treatment has begun. Chickenpox, shingles, or herpes simplex. Head lice at the end of the day until the first treatment. Any child deemed by local health officials to be contributing to the transmission of illness during an outbreak. Again, these requirements are based on the advisement of our pediatric medical advisor in caring for our children, which is considered an Air Force policy. The program will ask a parent to pick up their child from the program or will refuse admittance from the program if one or more of the following conditions that I had listed earlier exist. There are interim procedures for children who require exclusion. Exclusion just means that they will not be able to come back to care unless they meet some of these criteria. A child who becomes ill while in attendance is made comfortable in a location away from other children, such as an isolation room or on a cot in the library, and supervised by familiar staff. A child's parent or guardian are contacted immediately to pick up the child as soon as possible, typically within 30 minutes. The staff requests that parents contact the program with advice received from the child's medical professional if a visit was deemed necessary. Children, however, they can be readmitted when the signs and symptoms of the required exclusion are resolved, a minimum of 24 hours. Fevers must be without the use of medication. Parents are not supposed to bring children in while they're on medication either. An antibiotic, if an antibiotic has been given for a 24-hour period for known strep infections and fever, and the fever has subsided, they're allowed to be readmitted. They can also come back to school when lesions from impetigo are no longer weeping. This means that impetigo is no longer infectious and the child is well on their way to healing. With a written statement by a medical provider that the individual is following prescribed therapy and is cleared to return to care. And also last, if that child is able to participate in normally scheduled activities. The program procedures for reporting exposure to communicable diseases includes reporting all communicable diseases to the public health officials. You also must inform staff and families about the exposure to communicable diseases, providing appropriate information about common symptoms, incubation, and contagious periods after infection control. Remember, you must respect confidentiality, and you can never disclose to other parents that another child has a sickness or an illness. It is also never appropriate to diagnose a child that is out of your scope of practice. Remember, if there are any questions regarding this training, you are more than welcome to go to your training and curriculum specialist or direct your questions to the center director. Thank you.